Good afternoon. I wanted to take the time to give people an update with the latest data and information. I look at all of this information and talk to experts regularly to form my opinions, as well as to provide advice to the village board. While ultimately we make decisions as a board, I am well aware that the buck stops with me in my office. In my opinion, it is our job to provide information to the public as transparently, comprehensively, and accurately as possible. We can only give you the information that we have. This information comes from 4 primary sources: Illinois Department of Public Health, Cook County Department of Public Health, the CDC, and Cook County Medical Examiner. You can get this information for yourself, but much of it needs to be tracked daily because not all of the information is reported historically. I am aware of press reports that use one fact or one piece of data to sensationalize a story. For example, number of cases in one day, which is often due to lack of reporting on a previous day. The information that we have is imperfect and often ambiguous, which is why it's important to look at the whole picture before forming an opinion or coming to a decision. I take the time to consolidate this information and report it to you because it is important that we keep you informed. I cannot possibly know every personal situation in Orland Park among 60,000 residents. I also can't know the unique needs of every one of the 3,000 businesses in Orland Park. That is why it's important that you know why we are providing the guidance that we do. You need to make your decisions about your own lives and businesses, and this information helps you to do that. Personally, I think it is our responsibility to make sure that you have these facts so that you can make informed decisions. I would encourage everyone who is making decisions impacting the lives of our citizens to be equally transparent about the information we are using. In my opinion, facts lead to better decision making. With this in mind, I want to start sharing some slides. First, Orland Park is a very active community with a higher than average vulnerable population and has done an outstanding job relative to the remainder of the state. This is shown by the fact that the village has a 1% case positivity rate for population compared to 1.2 for the state, and the village employees themselves is half of that at 0.6%. So we do a really good job in the village of keeping everyone safe. I think what this also points out is that within the village hall, given how much exposure we've had, and we've been working the entire time, and this includes our first responders, that we've done a very good job of, when there are cases, of making sure that they don't spread to anyone else. So we've done a really good job of protecting our employees. In the past, I've shown you that the CDC has indicated that when an outbreak occurs, they look at 4 different levers to address the outbreak. They look at morbidity, but in this case, there's no known cures, so there's really not much they can do about it, which is what they told us. Back at that time, they told us the spread, it was going to be a pandemic. There wasn't going to be much that they could do to stop it from spreading into a pandemic. So their concern was to slow the spread, to protect the healthcare system, which is number 3, and also to balance that against the economic damage that those actions take. So as of March 15th, our focus was on protecting the healthcare system and the economic damage and balancing those 2 things. The goal of the stay-at-home order was to keep the healthcare system from being overwhelmed. That goal has been achieved, but somehow it has morphed into eliminating the virus. This will likely never happen in any of our lifetimes, as we have only eliminated one virus in human history, and that was smallpox, and that took hundreds of years of effort. That means that we need to learn to live with it. I think the current data that I will show you shows that we are adapting to living with it and getting back to normal safely. Not only do we need to keep people safe, we must open the economy. In the last few months, opioid overdoses are up, suicides are up, domestic batteries are up, and mental health calls have increased dramatically. Also, seniors are widely known to be the most vulnerable to this, and what pays for Medicare? That is what those 65 and up rely on: payroll tax. What does this require? Payroll. That means it requires jobs. Not to mention that the unemployment was at levels only eclipsed by the Great Depression. While the federal government has provided funds to allow for increased unemployment, the state of Illinois is still mismanaging those funds and not getting into the hands of people who need it. A solution to that is jobs that pay. That is why we will continue to use the facts in order to safely open and keep people safe. This slide shows you that social mobility in Illinois was at its lowest on March 27th. What this does is measures it tracks cell phone movement compared to their normal location. And it doesn't track individuals, but it looks at it globally. And so our low point was on March 27th at minus 56% of normal in Illinois, and as of July 1st, the latest data available, it was minus 20%. I would contend that Orland Park is even higher because that minus 20% includes people not going into Chicago. So you can see people are much more mobile than they were back at the end of March, as we've certainly noticed with the number of people on our streets. Daily COVID hospital admissions in suburban Cook County have trended down for 2 months after having peaked the last week of April, and they've been negligible for over 2 weeks. The reason why this is important is because the number of cases are not nearly as important as the number of hospital admissions. Because we're testing so much more, we're catching those asymptomatic cases that early on we wouldn't have seen. And really, they don't stress the healthcare system. They don't do any damage to the healthcare system, because they're not going to the hospital. What really matters, going back to what this was all about, it was about protecting the hospital system. And as you can see, in all of suburban Cook County, the number of hospital admissions, according to the Cook County Department of Public Health, is nearly zero for over 2 weeks. We've continued to open, and yet we've continued to see no increase in hospitalizations. That means that we can continue to open even more. COVID-related deaths in suburban Cook County have also steadily trended down for 2 months after peaking the first week of May. And as we've discussed before, this is a lagging indicator. So this is always going to trail the rest of the indicators, because obviously people get COVID and it takes them some period of time. If they do die from it, it takes them weeks or months to do so. So therefore, deaths always lag. But as you can see, those numbers are way down from their highs of 75 to 80 a day. Back at the beginning of May. Illinois ICU bed and ventilator usage by COVID patients has been flat or declining for over 2 months. You can see the numbers there. ICU beds have seemed to have leveled out somewhat. Ventilators are continue to trend downward. Additionally, the state requires, to move on to the next phase, a 14% ICU bed and ventilator bed threshold. You can see that for over 2 months, both of those ventilators and ICU bed availability has been well over that. In Orland Park, the last COVID-related death was approximately 6 weeks ago, 5 weeks ago. So it's been quite some time since we've seen a death, and that's good news. And again, that's a lagging indicator, so we really haven't seen much in the way of cases. We haven't seen much in the way of deaths. So Orland Park has continued to do a really good job. The sad part is that of our deaths, 97% of them came from long-term care facilities. However, 97% of them also had serious other health conditions. This page looks at all of the state's metrics, and it's from the IDPH page, and this is for the Northeast region. Now, we feel that we shouldn't be lumped in with Chicago, but this includes Chicago, and this is our region. And you'll see that every indicator that the state looks at is in the green for us to move forward to the next step. Additionally, the state has started sharing county-level metrics, which also indicate that Cook County can continue to move forward. Everything in here that there's a target for is meeting the targets that are set. This is very important new information that they're sharing. It's more data, more information, but everything that we've seen shows that the data is clear. That we've opened, we know we've done July 4th concerts. We've certainly, anyone who's been near the mall sees all the traffic around the mall, all of the retail stores, all the restaurants, how much more open they are, and yet we're still seeing cases declining or flattening. That's an indicator that we can continue to open, because remember, the goal of this is not to eliminate cases, it's to manage those cases so that the hospital system is not overwhelmed. We're accomplishing that. There are a couple of important things to note here. Currently, it seems that the entire national discussion is about masks. Regardless of your position on masks, here's what I'm afraid of. I'm afraid that we're focusing on the wrong thing, and we're forgetting why we have been successful to this point. The CDC, the WHO, IDPH, and everyone else agrees that the primary efforts for stopping the spread of COVID-19 are 1, staying home if you're sick, 2, practice social distancing, and 3, using good hygiene practices. Masks are not a substitute for doing those three things. If you're sick, please stay home. Don't get someone else sick. Please practice social distancing. Again, all of the recommendations are to only use masks if you can't social distance. So social distancing is the most important thing you can do. And I've heard many people say, well, I can wear masks because the mask will keep me safe. I don't need to social distance. That's not true. We need you to social distance. That's what's got us here. Please do that and continue to use good hygiene practices. I can't emphasize this stuff enough. Those are the things that are going to help us really get to the next phase. So please keep doing it. As you are all aware by now, long-term care facilities represent about 54% of the deaths in the state of Illinois and 97% of the deaths in Orland Park. The case fatality rate in long-term care facilities is about 17%, which compared to 2.5% in the rest of Illinois. So those are very dangerous places for their residents. Please do everything you can to not visit those facilities. And I know it's hard because I know your loved ones are there, but that's what potentially makes them sick. And if you are going to visit, please make sure you follow all of the precautions that are out there, including not just cloth masks, but be wearing N95 masks and make sure that they are as well, so that you can be as safe as possible, because obviously this is a huge portion, not only in Illinois, I think about 40% of the deaths in the country are from long-term care facilities. Additionally, we've talked about this as well. The CDC tells us that people over 65 should stay at home until the economy is reopened, because 93% of all the deaths in the US are 55 and up. And so it's very clear that this targets the elderly population. So again, if you are 65 and up, if you're a senior, particularly if you have some kind of pre-existing condition, heart disease or something like that, or you're immunocompromised, please take every precaution to keep yourself safe. It is much easier for you to keep yourself safe than it is for you to assume that hundreds of other people are going to be looking out for your interests. So please, please, please keep yourself safe and take precautions, because that's what's going to help make sure that this doesn't spread and that we don't have continued problems. Cook County and Illinois data also confirm that COVID becomes significantly more dangerous as you age, so there's nothing new there. Again, I can't emphasize that enough. Please make sure you take care of yourself. Here's some other interesting information. So since February, there have been more deaths from influenza and pneumonia than from COVID-19 in every age group. But in particular, I think it's important to look at those that are under the age of 14 and those from 15 to 24. Because we're currently in a national conversation about education in schools, and flu and pneumonia is much more dangerous to our students than is COVID. Additionally, if you look at deaths for children under 15, COVID represents 0.2% out of all deaths. That's 2 out of 1,000, or 1.1 deaths for people between the ages of 15 to 24. So, you know, your juniors and seniors in high school and college-age kids are about 1 out of 100. So, as you can see, COVID is not a massive threat to our children. So, I think it's important for schools and parents to factor this information into their decision making. At this time, I also want to announce some changes to our 2 paid concerts. On Monday night, I will be asking the village board to approve placing a video board with FM receivers at the Centennial Park West parking area to allow for people to attend a drive-in concert as well as the in-person concert. Each car will get 2 spaces, 1 to park and 1 to watch. Ticket prices will be the same for each person in the car, but it will give people the option of whether to watch in the park itself or from the parking lot. This is another example of thinking outside the box and giving people as many choices as possible so that they can make the decision that is best for them. I want to thank all of you for your efforts to this point, and I'm positive that with similar efforts going forward, we can continue our path back to normal. It's very, very important that we continue to social distance, continue to practice good hygiene, and if you're sick, please stay home. Thank you very much.